with how long it takes to see a health counselor on campus. We spoke to the USC Counseling Center to find out more about student concerns.
It was starting to interfere with my work.
Brittany Brazil is a freshman at USC from Washington, D.C.
I'm obviously really far from home, and just the stress and homesickness was starting to be a problem, so I wanted to talk to someone about it.
Brazil says she called the USC Counseling Center looking for that someone, and what she found was a month-long wait list. They told her she could see another doctor off campus, but never told her who.
That puts us out of school, so that obviously didn't make any sense.
I called the counseling center here at USC and asked if being homesick would be considered as urgent. They told me the next available over-the-phone consultation would be tomorrow at 1:30 p.m. They would then decide if it was urgent and either have me come in or wait 2 to 3 weeks.
The demand is exceeding the number of slots that we have currently, so there is a wait at times, not always.
Dr. Eileen Rosenstein is the director of counseling services at USC. She says the wait for non-emergencies is never much longer than 3 weeks.
You can imagine it takes a lot of courage to come into the counseling center and then to have to wait 3 weeks. My crisis is past. People pass on and say how frustrating that is, and we're trying to change that.
Today, administrators from colleges across the nation came together at a USC symposium to address how to best handle mental health on college campuses. New USC Provost Michael Quick spoke at today's symposium.
The largest issue that our student affairs group faces on campus is this issue of mental health, and we need to figure out how to deal with it.
Universities across the nation are recognizing it's not just enough to train our students academically, but we really have to develop the full person. And at USC, that's always been a part of our mission.
And Brazil isn't going to give up just yet.
I didn't get the sense that people didn't care, or the doctor that I talked to didn't care. It just the follow through didn't really surface.
There are resources on campus for students dealing with stress and other mental challenges. They include Mindful USC, the Institute for Integrated Health, and other religious organizations.